In the past week, 75% of UN missions within Gaza have been denied or impeded. This blockade is leaving families hungry, malnourished, without clean water, shelter, and adequate health care, and increasing the risk of disease and death. WHO took advantage of the precious ceasefire to resupply the health system and our warehouses. After 6 weeks of blockade, those supplies are dangerously low and will run out in 2 to 4 weeks unless the siege is lifted. Despite security risks, access restrictions, and dwindling supplies, WHO is staying in Gaza and will continue to deliver supplies, train health workers, support emergency medical teams, medical evacuations, surveillance for epidemics, and primary healthcare centers. WHO calls for the urgent lifting of the aid blockade, the protection of healthcare, unimpeded humanitarian access across Gaza, the immediate resumption of daily medical evacuations, the release of hostages still detained in Gaza, and above all, a ceasefire. 10 days after the earthquakes that hit Myanmar, over 3,600 people have been reported dead. 5,000 are injured, and almost 200 remain missing. With limited access to safe water, sanitation, and hygiene, there is an increased risk of disease outbreaks, including cholera, malaria, and dengue. 5 health facilities have been destroyed and 61 damaged. So far, WHO has delivered 140 metric tons of specialist medical supplies, and more is expected to arrive from Dubai today.
Some of the poorest nations with the smallest economies, the weakest economies, seem to have been the worst hit. So countries such as Lesotho, Madagascar, Cote d'Ivoire, a large chunk of their GDP could be wiped out by the tariffs if they continue, if they're sustained. And these are the very countries where external aid, a large chunk of which does come from the United States, is also critical to finance their healthcare system. So some of these countries, up to 30 or 40% of the total spend on health comes from aid, and a large proportion of that is US aid.
Measles is one of the most infectious viruses, and so measles anywhere is, in fact, measles everywhere. Also, just a reminder that measles is a deadly virus. I think people forget just how sick and how dead that virus can make you. What is clear is that the U.S. is working to control the outbreak and to shut the outbreak down. It is a multi-state outbreak. That measles vaccine is an incredibly safe vaccine, and it's incredibly effective vaccine. 2 doses of measles vaccine confers upwards of 95% efficacy, and a single dose confers over 90% efficacy.
At our last media briefing, I spoke about the impact of recent funding cuts on global health. In response, countries are revising budgets, cutting costs, and strengthening fundraising and partnerships. WHO has been working with countries for many years to support them to transition away from aid dependency to sustainable self-reliance based on domestic resources. We are now supporting countries to accelerate that transition, to avert the health impacts that these sudden and unplanned cuts are having.
I think today of the people in Myanmar, I think today of the people in Gaza, I think today of people around the world who've lost their HIV therapy or their TB therapy, or children who haven't been vaccinated dying of measles. And in the hierarchy of suffering, any suffering at WHO is in the halfpenny space compared to what people around the world are suffering. We recognise that we're in a situation where, with the advice and with cooperation with our member states, we need to contract the amount of money we absorb as an organisation in order to do the work we do with our member states and in the field. And we're doing that. And we're approaching that very, very responsibly in terms of cost containment, resource mobilisation, looking at the priorities in the organisation that we already set with our member states for a 5-year cycle, which would start in January next year. Within all of those deliverables, we are working at all levels to prioritise those deliverables, to work with the member states to agree what is the adapted work we will do, what is essential and must continue, what can be scaled back or postponed a little, and what can actually stop. And in the end of the day, we have to talk about what we can't do anymore.
I said it many times that the U.S. withdrawal from WHO, it's a lose-lose. It's in the best interest of the U.S. to stay in WHO. It's a health security that keeps the U.S. safe and the rest of the world safe by being in WHO.
Clearly, the pandemic agreement is not a panacea. It deals with the future pandemic. It doesn't deal with all of the issues that concern people's health around the world. But there is no question that having a framework for cooperation between sovereign states when it comes to the next pandemic is the basis for collective action that is needed, it is required, and it will save lives. And it will be an efficient way to deliver.